Good morning, good afternoon, and good evening to our audiences from around the world. My name is Bonnie McClafferty. I'm the Director of Food Safety at the Global Alliance for Improved Nutrition. GAIN is your host for this webinar today. Coming hot off the heels of the UN Food System Summit, GAIN is delighted to be hosting this first webinar in a series that focuses on building from that historic summit to accelerate action for food safety. On September 23rd, the Food System Summit was held in New York. And during the build-up to that summit, hundreds of thousands of people from government, civil society, business, development agencies focused on solutions that could transform the choices we all make about food, what we grow, how we grow it, and how we ensure it can safely and sustainably nourish humanity while protecting the planet. This webinar has been planned and to capture and ride the momentum of that historic summit and to raise the clamor that unless foods are safe, the ambition for assuring access to safe and nutritious foods for all simply cannot be reached. We now need to move from ideas to action. For those who did not participate in the summit, it is worth noting that preparations for the summit have been underway for nearly a year. And I would like to take just a moment in opening this webinar to thank Pawan Agarwal, Delia Grace Randolph, and Caroline Smith DeWall for carrying the food safety flag in the preparations leading up to that summit. The summit itself produced food system dialogues with leaders from over 140 countries. It generated thousands of game-changing ideas to transform the food system, including for food safety. It generated mountains of new evidence on how the food choices we make irreversibly affects human and planetary health. By launching this summit, the organizers left behind for history the idea that food and health were two separate universes. For those of us working in food safety, separating the two has never really been an option. We know that each day unsafe foods are making millions of people sick, and many critically. We also know that considerable efforts need to be made to reduce contamination of foods around the world, including, but not limited to, understanding and measuring the extent of the problem, establishing regulatory and legal structures and capacities to support domestic food safety, driving a fresh focus on foods for domestic consumption and traditional, particularly from the traditional and informal markets where many of the vulnerable are sourcing their foods. And developing capacity to govern, to regulate, to test, to oversee the safety of the foods we are all consuming. For GAIN, if food is not safe, it cannot nourish. And we've been working on food safety for quite some time by ensuring the quality and safety of fortified foods. That's our common practice. By supporting SMEs to produce safe and nutritious foods, by assessing nutritious food supply chains and innovations that make diverse and nutritious diets available, affordable, and safe to eat. And through our flagship program on food safety, EatSafe, where we are seeking to better understand and harness the power of consumers to demand safe food from her undoubtedly hazardous traditional markets where there is limited infrastructure, often no sanitation facilities, nor water, and certainly no regulation, inspection, or food safety oversight to protect she and her family. With this panel and discussion today, we are building from where the summit left off. To transform the food system in a culture of safety, we will need different policies, practices, and resource allocations at the global, national, and regional level. But we need to start by understanding the realities on the ground for making safety a priority, considering politics, financing, scalability, inclusivity, and the gaps. In this session, we have decidedly focused the discussion on regional action and recognize that specific countries' experiences are worth noting. We note that governance is not just for individual governments. Today, we've assembled a group of regional food safety experts to tell us what they're experiencing and see across the regions of the world. I would like to introduce Steve Wern, the moderator for today's event. Many of you know Steve. Steve is the Director of Global Affairs at the Food Standard Agency in the UK, but he's also the Vice Chair at the Codex Alimentarius Commission. Before I turn it over to Steve, a few housekeeping notes. And I think my slide might follow me here, but a few housekeeping notes. Please note that this session is being recorded, and we have reserved ample time for questions. Please add your questions by clicking on the Q&A button at the bottom of your Zoom console. After today's session, the recording of the webinar will be available on the GAIN website. So over to you, Steve, and thank you personally for moderating the discussion today.
Thanks, Bonnie, for that introduction. And I'd like to add my own welcome to all participants joining us today. And I understand that over 400 people have registered to join us, so hello to everyone. Our discussion today is vitally important. And as we reflect on the new linkages and networks that have been formed as part of last week's UN Food System Summit and the year of activity that preceded it, and the new commitments we heard last week, we now need to focus on accelerating action for food safety transformation, as Bonnie has said. And the profile we're giving to food safety in this and related webinar should be no surprise. The World Health Organization estimates that 600 million people suffer from foodborne illness each year, of whom 420,000 die. Both the World Health Organization and the Food and Agriculture Organization of the United Nations have been charged by their member countries, the countries that we all come from, to develop renewed food safety strategies to meet those challenges of today and of tomorrow. So against this background, we need to mobilize action and take every opportunity to promote the importance of food safety practices throughout the entire food system, from production and processing through both formal and informal markets. Every single person in that chain needs to commit to providing safe and suitable food and encouraging appropriate food safety practices in their peers. And that's how, for me, we make food safety culture actionable. Food safety truly is everyone's business, because if we don't have food safety, we don't have a food system. But that's enough from me. Let me introduce you to our distinguished panelists for today's webinar. First, Dr. Omare Ayelu, who's held the position of Programme Manager of the Partnership for Aflatoxin Control in Africa at the African Union Commission since 2013. And in this role, he's led the programme's strategic planning, launch and implementation of country and regional programmes, continental and global advocacy in aflatoxin control and broader food safety, as well as the generation of locally relevant evidence key to risk management. Dr. Ayelu also has a distinguished research career. Dr. Ayelu, welcome. The floor is yours for your opening comments.
Thanks very much, Steve, for the introduction. Hello, everyone. First of all, I would like to thank the organizers, EatSafe and GAIN, for putting together this webinar, especially, as Bonnie said, coming out of the UN Food Systems Summit. By way of introduction, allow me to raise 2 points. Number one, as a region, Africa is the worst hit by the impact of unsafe food. For example, the 2015 WHO report on burden of foodborne disease indicates that the mortality rate from foodborne illness in Africa per capita is twice the rest of the world. So the economic cost of unsafe food to Africa is also enormous. So African countries cannot afford to let such status quo to continue. Number two, there are important developments in the continent. African countries have begun trading under the Africa Continental Free Trade Area at the start of the year, and there is increased trade-driven commitment for improved food safety in Africa, which actually can be harnessed to raise food safety levels more broadly. So with that, glad to be here and happy to share our experience and also learn from others, and hopefully contribute also to charting some ideas for a better food safety. So with a big thank you to the organizers for giving me the opportunity. Back to you, Steve.
Thank you, Amari, and some really insightful opening comments to help us focus on the fact that the impacts of foodborne illness aren't symmetrical in any way, but also that prospect of the African Continental Free Trade Area acting as an impetus for bringing food safety to the forefront. And I know that in Codex, for example, we've agreed to support the development of food law harmonization to support the continuing development of the free trade area. And I'd like to turn next to Ana Marisa Cordera, who's the Agricultural Health and Food Safety Acting Manager at the Inter-American Institute of Cooperation on Agriculture, which you may know as IECA. Ana Marisa has significant international experience in the assessment and modernization of national food safety control systems, so key to the work we're discussing here today, and of veterinary and phytosanitary services too. Ms. Cordera, welcome. The floor is yours for your opening comments.
Thank you so much, Steve, for the introduction, and thank you very much for the invitation. Glad to be here and glad to share some first thoughts in terms of the importance of food safety for the region. The Americas are one of the world's leading food producing and exporting regions, covering 1/4 of the Earth's land area and home to over 1 billion people. The hemisphere has enormous natural wealth and diverse and productive agri-food industry and a robust family farming sector. Despite these advantages, or perhaps in part to them, food safety is of central importance to all countries in the region, regardless of their level of development. To take advantages of these opportunities, countries and their productive sectors must have food safety policies and strategies that function, access to technology and best practices, and a fair trade environment to ensure that they can provide the food they need and capitalize on the business opportunities that drive the national economy. So thank you again. Thank you to the organizers, and thank you for giving me the opportunity of sharing with you the America's perspective on this topic. Thank you.
Thanks, Ana Marisa. And now I'd like to introduce Dr. Phuc Pham Duc, who's the coordinator of the Vietnam One Health University Network. He also holds positions as Deputy Director at the Center for Public Health and Ecosystem Research at Hanoi University of Public Health and Director of the Institute of Environmental Health and Sustainable Development. A medical doctor by training, Dr. Phuc's research has focused on health risks related to water and sanitation, especially at the interface between environment and health, which again came to the fore in discussions at the UN Food Systems Summit last week. Dr. Phuc, welcome, and the floor is yours for your opening comments too.
Okay, thank you very much, Steve, for the introduction, and thank you very much, organizer, giving the chance to join this very important event today. So I'm a medical doctor by training, so I'm very interested for this topic. And as you know, that food safety and food security is very important for everyone in all the global context in every country. So As you know that when you mentioned about the food safety, not only one sector can solve this issue, but we need to multi-sectoral collaboration. Actually, it's agriculture, human health, environment, also as in a business and even social science sector need working together. So how we can ensure to access food and nutrition food for all, and how to building resilience for the vulnerable people, and of course to make promoting it sustainability for food production at own scale level. I think it's very important. So how we can do this? That need very important for human resource. It means that we try to building capacity for different level, also in different country, and of course in all the world. So I think that we can to succeed, we need to prepare and respond with a human resource. So based on our university network, we see that generate a future leader. It's a multi-sectoral collaboration. I think that's very important. So the food safety is a very good example. We need to working together. So thank you very much, and I would like to join this session, and we can get later. Thank you very much.
Thank you, Phuc. And the topic that you raised there, which is how do we take action now to build capacity at every level in the system, is a question we'll return to, I'm sure, later on in the next hour and a quarter. So thank you to all our panelists for introducing themselves. As already mentioned, this is just one in a series of webinars and other engagements with countries and regions that our hosts today have undertaken throughout the Food Safety Summit process. A number of themes continue to emerge in these discussions, and we've used these as the basis for questions that I'll now pose to our panelists. The first question I'll pose to each of our panelists in turn, turning first to Dr. Ayalu, so just to put him on notice. So the question is, what efforts are currently underway at the regional level? What are some operational realities or country level cases from Africa, in your case, and then Asia and Latin America, that are being experienced? Dr. Ayalu, what would be your answer? Over to you.
Thanks again, Steve. I will address this question at three levels, of course, very quickly, at the continental level, at the regional level, and also the operational realities at country level. I'll be quick at all of these three areas. As I mentioned during my brief introduction, on the 1st of January 2021, the continent, the African continent, has begun trading under the Africa Continental Free Trade Area. We call it AFCFTA. The AFCFTA is the largest free trade area globally in terms of the number of countries. It brings together 1.2 billion people and a combined GDP of 2.5 trillion US dollars. And so far in the intra-Africa trade, agriculture and food products dominate the trade. So clearly the Continental Free Trade Area will be an important driver to boost food safety. However, we should be careful to avoid past mistakes so that we don't follow a lopsided approach, focusing a lot on food safety for export trade. So this is one important development and driver happening in the continent. Also, there are other commitments to end hunger or to reduce poverty, to increase income in the continent that are also driving improvements in food safety in Africa. I think I should also mention another development, which is the African Union is developing also a continental food safety strategy, which will definitely help us to address food safety more holistically. And also another important development is the establishment of the Africa Food Safety Agency. So this is underway. The African Union is in the process of establishing the AFSA, the Africa Food Safety Agency. And of course, all of us food safety stakeholders within the continent are waiting eagerly for this institution as the institution to improve food safety coordination in Africa. Then coming to the regional level, for some of you, this might be sub-regional level. Within African Union, within Africa, we have what we call regional economic communities, RECs for short, which are the building blocks of African Union. Many of these RECs have got food safety and sanitary and phytosanitary capacity building programs, and they will definitely continue to be very important for coordinating regional efforts. Maybe to quickly reflect on the operational reality at country level. Of course, this will be very difficult to make generalizations, but I think on the whole, most African countries appear to have in place most of the components of a solid food control system, but implementation appears to be a challenge. So the existence of these different components of food control system is not being translated into better food safety. In many cases, food safety is fragmented, very much fragmented, and with little coordination. In fact, what is happening is when things go well, food safety becomes everybody's business. But as is usually the case, when things go wrong, it becomes nobody's business. So there is little coordination in terms of institutions and so on in many countries. The other thing is, with very few exceptions, food safety is not part of national development strategies or even sectoral policies. So in short, there is a lot to be done in terms of giving food safety the attention and prioritization it deserves at all the different levels. So let me pause here. Back to you, Steve.
Thank you. Thanks very much. I'm busy scribbling notes because so many insights there that we may want to return to at the continental, sub-regional and national level. Particularly for me, there's a question about if many countries in your region already have in place the building blocks for national food control systems, but implementation is the issue. How do we overcome that barrier? Is it a governance issue? Is it a capacity issue? How do we diagnose and then address those issues? I'm sure we'll come back to that. But the same question then, efforts currently underway at regional level and operational realities at country level. Ms. Cordera, Ana Marisa, what would be your perspective on Latin America? Over to you.
Thank you so much, Steve, for your question. I just want to share a recent experience that we at the Inter-American Institute for Cooperation on Agriculture have as the agency of the Inter-American system specializing in agriculture. AICA became involved in the Food Systems Summit process leading up the summit in conjunction with and in support of its member states. ICA emphasized the importance that the food system transformation process took into account the views and facilitate the participation of farmers, other production chain stakeholders, and the ministries of agriculture of the countries of the Americas. AICA member states of the Institute highlighted the contribution of the hemisphere agri-food sector to global food and nutrition security, stressing the following three principles. Agri-food producers should be adequately represented, and their leading role in the transformation of the food systems should be fully recognized. Second, the decisions and policies to be adopted should be science-based. And third, agriculture and agri-foods and food safety are part of the solution to the main challenges that humanity should consider when looking to the future. The ICA has organized several related dialogues for action, engaging the participation and contribution of key stakeholders who have reached consensus regarding messages that the agriculture and rural sector of the Americas conveyed at the Food Systems Summit in 2021. And those messages were developed around 4 main topics: principles for the transformation of food systems, consumer demand and nutritional aspects, production strategies and environmental matters, and the role of the Americas. The most important in terms of this experience is that the political leaders reached an agreement, and 16 messages around the areas mentioned before reflect the position of the Americas. So just want to mention that the same applies to food safety. Food safety requires political commitment and the active participation of all the key stakeholders along the food chain. And this is part of the challenge that we need to work around in terms of developing capacity building strategies and education strategies to promote the importance of food safety, not just at the economical level, but also to protect the health of consumers. Thank you so much.
Thank you, Ana Marisa. Let's continue then with our first question for the panelists. Dr. Fuchs, so looking at Asia region, the continent of Asia, what efforts are currently underway at the regional level there, and some operational realities that you're aware of at country or sub-regional level? Over to you.
Thank you, Steve. A very important question. So from my side, I think that it's important to note that at the current food system in all the countries, including in Southeast Asia or in Vietnam, I think it's within in the comprehensive framework of the national and local provincial level. I think that at all levels, including the policy, strategy, plan, and initiative. So they address agriculture and development, industry investment, trading, poverty, malnutrition, health, and nutrition. So that including it's a climate change. So these different sectors really need to work together. So for each sector, they have a national action plan. So how each policy and strategy is a critical part of the current context from which consider how the food system in our country can be changed and how to manage its food safety based on the risk-based approach surveillance system. So for example, in Vietnam, it has some relevant national plan, like its social economic development strategy belongs to mutual planning and investment. And as it's a national action plan, the agriculture restructuring plan belongs to the Ministry of Agriculture and Forestry. And as the national action plan for zero hunger belongs to Agriculture Ministry, and of course the national nutrition strategy belongs to the Ministry of Health, and food safety agency belongs to the Ministry of Health. So that it's a different sector. They are it's separate. It's a national action plan. So we become to the food safety. They need to work together at a different level, even from the center to the province, in the commune and the district. So it's a very, very important. For other things that it need to make very clear and transparency to sharing the data information different sector. So from my side, I'm in the human health sector. What happened when the people they consume the food? What kind of food? food grow where is this, who manages this. So that's human health sector need to link it and request the information, it's an on-time sharing with a different sector. So the third one, it other thing, I thinking that it's a capacity for each actor along the value chain, from the farm to the table. They need to link each other and sharing information and make sure that it's a product, for people easy to access, and it makes sure that the quality and quantity of the food. And I think that it's one is as need to focusing in the vulnerable people who are living in the remote area, mountainous area, very difficult to access the food. Almost they consume it, it's not the quality of food. The quality of food make it imbalancing between the nutrition, malnutrition, and the health issue in the rural area, peri-rural area, also in the urban area. So that's it's a government or in the general level need guide it's a framework, comprehensive, working together and to make very concrete strategy and to sharing information. So I bring this issue very important for capacity building, of course, for the existing professional who are expertise working the food safety and food security, but very important to change their mindset in the future. We need to change its student like a pre-service training, so they are it becomes future leader on food safety, and we make sure that in the government we need to have one agency at the government level to manage its food safety issue and bring it a different sector come together. So that from my side and what to speak. Thank you very much.
Thank you. So let's continue with our questions. And for the next questions, I'll ask each of them to one of our panelists. And the next question is one for Dr. Ayaliu. It's, how would you describe region and country receptivity and obstacles to achieving some key goals? And there are 3 goals that I think we might discuss in turn, and I'd like your views on. The first, better measurement and better food safety data. So back to you.
Thanks very much, Steve. So in terms of better measurement and food safety data, within Africa, actually, we are witnessing very high level commitment in terms of collecting and submitting data on food safety. I will be specific. In 2019, the African Union, working with technical and funding partners, introduced what we call the Africa Food Safety Index, which is the first of its kind globally. So in 2019, 49 out of the 55 member states submitted data on some aspects of the Africa Food Safety Index. This year in 2021, 51 countries have submitted data on the Africa Food Safety Index. Of course, I said there is commitment. I didn't say there is capacity. So if we can use this opportunity, to translate this commitment into better data, adequate data, more comprehensive data for risk assessment and risk-based food safety management, I do believe we have got the opportunity, in Africa. Maybe one way to approach this is to more broadly support countries to strengthen their food safety monitoring and surveillance programs. So let me stop here.
Thank you. Let's then look at a couple of other goals that have been identified in the dialogue that GAIN and EatSafe have had with countries over the past year. So the second is a focus on national food safety investment for domestic consumption and public health. So getting away from the lopsided approach that you characterized earlier in so much past investment. What do you think the receptivity there is for that investment?
Unfortunately, there is excessive focus on food safety for export trade. Oops, I hope I have unmuted. Yes. So as what I'm saying is, there is still a lot of focus for food safety for export trade. So even the limited investment in food safety, the meager resources that are going to food safety at country level have focused on trade. And there is actually a need for a more strategic shift to address food safety within the domestic market for domestic consumption and public health. Actually, there is a strong justification for this because a focus on trade has not proven to have a spillover effect for domestic food safety. Unfortunately, we haven't seen evidence for that. And the government focus on official controls for export shipments actually has not helped the countries to establish the food safety culture, the food safety norms that are important as a whole to boost food safety levels. So even the export trade is not benefiting actually from this lopsided export-oriented focus on food safety. So the issue is here, many African countries have not got out from exporting live animals. They focus on food safety for export, but it didn't help them to develop the food processing and related industries and, to add value to their export commodities. So I think the choice is for the countries, whether they choose to continue to export live animals and raw unprocessed agricultural produce, or whether they want to build a better food system and make the best out of their agriculture and food sector.
Thank you. A clear challenge there and choices for many countries in your region if we are to focus investment on domestic consumption. So the third of the three goals then that I'd like your views on is the increase in capacity for analysis and laboratory infrastructure. What's the receptivity to that in Africa in your view?
This is very much related to the first point on data generation and building a better surveillance and monitoring program. Maybe it's better if I cite a study that was conducted in 2018 by the Association of Analytical Community Sub-Saharan Africa section. So AOC did that study in 2018, and what they found was there are about 300 registered food testing labs in Africa, which is good. Maybe we can improve, but not bad. However, a majority of this, about 60% of the labs, of these 300 labs, were not accredited for the tests they were doing. This is, of course, not so very good. And about 50% of the labs reported that they have some analytical equipment that they have never used. So, the analytical capacity is one area that requires actually huge improvement. However, it's not all doom and gloom. Of course, countries are at different levels in terms of their testing capacity. Most of them, of course, are still grappling with, achieving basic proficiency. But of course, there are some countries that can serve as center of excellence, and of course, that have well-functioning food testing labs. So I think as a whole, we have to invest in testing capacity, especially if we want to, to boost trade within Africa, but also more broadly, to support better food safety we have actually to invest a lot on testing capacity. So I would say it's not an issue of receptivity, it's more of capacity, and also more of an issue of fine-tuning where to invest in terms of testing capacity. Clearly, manpower is a huge area, to improve testing capacity within Africa.
Thank you. There are some clear pointers there about actions that can be taken to improve and enhance the capacity that exists. Thank you for those answers. Turning now to Ms. Cordera, a question for you. So from a regional perspective, the regional perspective of Latin America, and in line with the 2030 Sustainable Development Goal agenda, how can we achieve sustainable impact on food safety into the future, into 2030 and beyond? And who needs to sit at the table in your region for us to have an action plan that will actually deliver to the Sustainable Development Goals? Over to you.
Thank you, and thanks so much for your question. Well, in terms of this question, it's important to have in mind that countries need to develop institutions and modern systems at the national and regional levels to take advantage of new opportunities in national and international markets while protecting consumers, agricultural production, and natural resources. Public-public coordination efforts and public-private interaction are critical for the design and implementation of robust and effective policies. As you know, in terms of food safety, the competences at the official level are usually split into the ministers of health and agriculture. So it's important that this for this leader to sit and discuss the importance of having effective food safety policies. Therefore, it's also necessary that these sectors collaborate with each other to take advantage and maximize technical capacities and investments such as those made by the private sector in food safety. It's a matter of trying to optimize the financial and technical resources for the implementation of effective food safety policies and regulation. In addition, regional integration mechanisms coordinate and facilitate cooperation and are increasingly linked to coordinated strategies on issues of common interest and the development of consensus positions in international arenas. In this way, regional integration can drive modernization across the Americas as countries that rely on one another are more likely to work together in positive and productive ways. So it's important, and now the regional bodies that in the Americas in some way have a specific interest in the area of food safety are trying to identify and work in the development or effective food safety policies and regulation at the regional and also at the local level. It's a way of driving the change in food safety. At the same time, fair, transparent rules based on scientific evidence are the basis for functioning and national and international markets. The regional bodies in the Americas must have capacity to participate in and influence the standard setting process to safeguard their commercial and production interests. The three international organizations that conduct this work generate new standards and new revised codes every year. And many countries and some regions still struggle to keep up with these new developments while meeting their responsibilities to implement laws and regulation. This is something that in some way needs to be tackled at the regional level. So it's important that it's important to develop also a effective communication mechanism among the different regional bodies to promote and discuss how they can be active in the international arena. Also, beyond threats associated with any specific product or commodity, the most pressing challenge is to establish, promote, and support a food safety culture and effective food safety policies and regulation in which all the actors among the food chain expect and have access to healthy food, regardless of where or by whom it is produced. Special attention needs to be the small and medium agri-food growers need special attention, and they need some education since the beginning in terms of the importance of food safety. At the same time, if you can see, there are many emergencies and emerging issues around food safety. And in some way, this is a constant threat to production and markets. Countries and agri-food producers need to implement scientific and technological innovations programs and available knowledge to increase productivity and also to address health problems in an integrated manner. So in this way, the One Health approach in which agriculture, health, and environment authorities dialogue to achieve effective food safety policies and also to protect the health of consumers is an approach that in some way it's important to think about, and it's important that regions try to be involved and promote this approach. Also, regulation and practices that guarantee the safety and the quality of agri-food products are necessary, taking in consideration the great diversity of production systems across the America. Variability in agricultural systems caused by climate change is a new and evolving challenge, resulting of increased frequency and severity of diseases outbreaks. These emerging challenges and emergencies produce important impacts in the food safety system. So that's why it's important to promote and establish technical institutions and improve their technical capacities to address these needs. Food safety is a shared responsibility. All the actors have a specific role in which the commitment and leadership of the decision makers are key elements to reach effective regional food safety policies and regulations that contribute to promote education strategies and a food safety culture along the food chain. Thank you.
Thank you, Ms. Cordera. And a couple of themes there that continue to come up in our discussions, don't they? First of all, the challenge of joined up governance within countries where responsibilities may be split between different ministries. Second, and more positively, I think the potential, the huge potential there is for regional integration to drive modernisation across the whole sector. And one issue that I'd like to talk to Dr. Fook about a bit further, which is the need for effective and inclusive coordination across all stakeholders. So my next question, which is for Dr. Fook, is how can food safety be more inclusive and for safe food to be accessible for everyone everywhere? What would that look like in action within your region? And what are the challenges then for assuring food safety in all food businesses, whether in formal or traditional markets, in international trade or domestic consumption, so across the whole of the system? Over to you.
Thank you. Well, I believe it's a...
Sorry, Anna Marie. So I was going to turn to Fook to answer that question, but please, I'll come back to you then to see if there's anything you want to add. No problem. Fook, thank you for waiting. Over to you.
Thank you very much, Steve. Good question, and I don't know how to answer this. A lot of things, but from my knowledge and experience, I think that how to access safety food or nutrient food. I think the first thing very important, we need to identify what's the policy and regulation at the moment in the buy and market-based solution to promote and increasing the demand of the healthy and nutrient foods. It's very important. So we need to strengthen the policy, regulation, how it's enforcement at a different level, so that at the market to promote healthy food and nutrition food. The second thing I think is very important to promote the adaptation of sustainability, safety food for increasing global demand or country demand. It's a winning need to pay. So it means that if improving it's healthy food, so people they can willing to pay it's a high price or not, and how they can believe that the product is a high quality. So it means that you need to develop innovative certification, or it's a system to provide very clear it's a market signer and information to the consumer. So make the consumer trust it's a food, it's a major quality. So now even in Vietnam country, sometimes we're thinking that it's a criticize, it's a communication. The people, the consumer, they don't know, they're not charged about the food. Even the food produced, it's very high quality. So that's the second thing. Another thing I think that's very important, how to improve the food safety system with increasing the evidence. So the risk-based management and communication about the cost, risks, or impact of the food safety problem. So we are still missing the data. Actually, it's an economic impact. We not bring very clear for all the stakeholder, including the policy maker and consumer, how it's impact in there, it's economics, and how it for the health impacts. So that's the third one. I think that's very important. The other thing that need to develop the food safety research and intervention. It's a tailor to but very specific food value chain. But you know, we're talking about the food. So we're not food. It originates from animal or from vegetable or fruits. So make very clear, like it's a poultry or pig or castor or it's a fishery. So it's very big general. That's why I need to bring very comprehensive intervention. It's a model we come to success. And other thing I think very important, such as support for multi-sectoral collaboration, and it's a food system approach to reduce the persistent like malnutrition or food poisoning, something like that, or how to improving its kind of poverty. So need to make very clear between the agricultural sector and the health sector and other sector need really working together. And the last thing I would like to mention here is that how we need to review and update the policy, the education and communication program. So especially it's a mass media or mass communication. So sometimes the mass communication, they capture the information not in a urgent situation. They not really to deep understand in the context. It based on the risk base. That's why they brought the information for the audience in not correct way. Because that is one as an issue. So also, it has a very important how we can bring private sector collaboration and promote healthy food. The private sector, they are very, it's keen and provide very concrete, but they're not really easy recognized or accredited by the government agency. So that has an issue. But that's why if we can bring them, we come with us, it's at the early step with a scientific and policy maker seeking together and bring the same concept. I think that could be better for how for everyone can access food safety. So, but for the challenging, when you ask a question, a lot of challenging for about that. Maybe it can lack of human resource, infrastructure, it's technology, of course, and other like the culture, the norm, it's a different context. Even in Vietnam, we are in the mountainous area, in the north, in the south, people have a different culture, behavior. For example, almost in the rural area, they prefer to buy the fresh food in the wet markets, church markets. They don't like go to the supermarket or boutique or convenience store. They say that not really it's convenient and they don't like to eat cooling meat, something like that. They would like to see it very fresh. So that's a culture. So I think that it's a barrier for us how we need to overcome. We need to really to understand. We need to stay with the local people, really to understand what they need and based on what they are available resource and make a planning with the local people and using their resource available and they are doing by themselves. It could be better, not become rely in our activity, but need to answer what they need. So I think that one is challenging for it. And other thing as I mentioned before, that it's a capacity building. It's a lack of it's a quality of a laboratory to testing detection and to know how it's a food, it's a quality or safe or not, and how to inform in time or on time for different target audience, consumer, stakeholder, or a scientific person at the same time. So that on some it is challenging how many people to access the food safety. Yeah. That's all from my side. Thank you.
Thank you, Dr. Fig. I mean, we've certainly reached an issue that clearly you believe passionately about. As you say, it's a huge challenge, but in breaking it down in the way you have, you've also given us some insights about how we might turn it into a series of actions that can be undertaken. Anna Marisa, as promised, back to you in case there's anything you want to add.
Thank you. Just thank you again for the opportunity and apologies for the misunderstanding. Just want to emphasize what was mentioned before regarding the importance of capacity building and develop these communication strategies among the leaders that in some way can drive the change in terms of the importance of food safety. And when we are talking of food safety and this relation with the with the official leaders, it's important that they be aware on how food safety means, how we can measure the food safety impacts in terms of social, rural and economic, and in terms of social, rural and the economic areas, because this is a way to show them that food safety, it's everybody's business, and we all have a responsibility on this. Thank you.
Thank you. Now, there's one final question in the set I'd like to ask before we turn to the question and answer session and look through some of the questions that participants have put in. So to allow us as much time as we can for that important part of our session, I'd like to ask panelists to be brief in their answers to this question. Once again, I'll talk to each of you in turn. So our final question in this part of the session is, what are the biggest challenges for capacity development? And does your region have the expertise, the infrastructure and governance models to make it happen? What are the drivers for action? What are the attributes of success? And what does a positive food safety culture look like in your region? So turning our mind to capacity development and trying to break it down for your region. Brief answers, please. And I'll turn first to Dr. Ayalu. What would your answer be?
Thanks very much again. Okay, let me say this. As I already indicated, the 2019 and 2021 Africa Food Safety Index data shows that we have some level of food safety control systems set up within African Union member states, at least in many of them. And as I said already, implementation is a challenge. So for these, the biggest gap appears to be actually food safety workforce. So food safety, when I say food safety workforce, it includes, a cadre of food inspectors, regulators, food analysts, risk assessors, what have you. So, by the way, I don't think this problem is limited to Africa or even low and middle income countries. It is probably a universal problem almost globally. So this is one huge area where there is a challenge and a limitation. The other thing is, also, we have to improve the breadth and quality of food safety data for risk-based and science-based approaches to food safety. So this is another huge area where improvements are needed. So I think for all of that to happen, there is a need to actually mainstream food safety in national government strategies and sectoral policies. It's only then that it will be reflected in national budgets. And if that happens, of course, all of the good results will follow. So I think we can learn from others, but in my opinion, success in better food safety in Africa should be translated in terms of reducing foodborne illness and mortality, especially for children under 5. But more broadly also in making our food systems more vibrant, which are able to support jobs and incomes, but also boosting export trade. So let me stop here.
Thank you. And I think that issue about mainstreaming food safety in governments across all regions is something that really resonates, and hopefully not just with me. I turn now to Dr. Fook, the same question to you about Asia region. Over to you.
Okay, so yeah, thank you very much. So I think it's a bit challenging. I think that the first very important is the impact of climate change on the food system. So actually in Southeast Asia or Vietnam, it's a big issue when it's climate change. So the food system is they can change, and that is not get certain for us to make land development in certain way. That's the first thing, very important. So how the second thing is the very rich, it's a coordination and collaboration. It's a cross sector military. This is other challenge for us. It's also it's a policy. It's an overlap, and that is very complicated in the implementation. So actually at implementation at the lower level, the people they don't know how they can follow which regulation or policy belong which sector, because it's an overlap policy. So that's another thing. And of course, it's limited. It's private sector collaboration, of course, and the food system, how to reduce the investment. It's public and private sector work together. And of course, and other thing, we are limited to application of the digital technology. It's a new technology. Actually, in the rural area, it's not really many times for them to apply each technology and to sharing data information. What it's a good model for them to in the food production and how they can improving the food safety. So and it's other thing. It maybe it's a related consideration about the gender. It's equality and social. It's inclusion. So increasing it expose actually people living in the remote area or the minority group people compared with in the lowland area. So that is inequality about access to the food and the food safety in a different area. So I think that is a big challenging for us. But now how we can do that? We need to change the mindset of, I think the first very important is the leader, the policy maker. How? Based on its scientific evidence base, from identified evidence base from its international organization on the domestic organization working together and provide very concrete evidence to the policy maker. Need to change the message. The second thing, need to improving the capacity of all the actors along the value chain for each food system. So I think that if we can do that, it take time, but at least we make it more comprehensive and how it bring different sectors working together and to solve it food safety issue. Yeah, that's all from my side. Thank you.
Thank you, Dr. Fug. And the same question now, last but by no means least, to Ms. Cardero. Your thoughts, please.
Thank you. Thank you so much for the opportunity. I would say that one of the main challenges is how food safety can become a priority among the food safety, among the government leaders, how we can raise this topic, how we can show them that food safety matters and it's important and a shared responsibility. And also, how can we implement effective risk-based food safety policies along the food chain? And in terms of how can be done on this area, I would say that the importance of implementing effective strategies and work among the stakeholders, private and public, it's a way to start working on this topic. And in addition, the development of capacity building, how we can learn from other countries that are in upper stages in terms of food safety implementation. Thank you.
Thank you, Anna Marisa. And I'm ready to heed your call. I mean, I think we should all be passionate advocates for food safety and for the actions needed to deliver it across our various spheres of influence. Time now, though, to turn to our question and answer session, which is the opportunity for me to put to our panelists the questions that you have posed in the Q&A function. Colleagues have been monitoring that throughout the webinar, trying to integrate your questions by theme, and we'll try to answer as many of them as our time today allows. So I'll go through them, identifying a panelist and asking the question. And for our panelists, I'll ask you wherever possible to give brief answers so we can run through as many of these questions as we can. The first one to Dr. Ayaliu, and it's in response to a point you raised. So what will be the mechanism to translate the food safety strategy developed by the African Union into practice? And how empowered do you think the Africa Food Safety Agency will be to drive and contribute to the African continental food safety system? Over to you.
Thank you. Thanks a lot for that question, for those questions. Actually, there are two. So to the first question on how to translate the continental food safety strategy into action. Actually, the strategy is under development. We hope it will be approved towards the end of the year. So the strategy actually outlines roles and responsibilities for different players. So the African Union will have roles. The regional economic communities that I mentioned will have roles. Member states will have roles. And as my fellow speakers mentioned, food safety is everyone's business. So this will be implemented not just by the African Union Commission, but by all of us. So and the tools and mechanisms for implementation will be different. I hope this will be public towards the beginning of next year. On the Africa Food Safety Agency, as I indicated, this is still underway. The establishment of the agency has not materialized yet. As many of you might recall, the African Union Commission chairperson announced the need to establish this agency at the 2019 International Food Safety Conference that was convened with the FAO and WHO as the African Union Commission. Following that, different efforts are underway to make it happen. So when it is there, it will be there as a specialized technical organization, STO, of the African Union. So it will be an independent entity like, AU-IBAR, if many of you know it, or AU-IAPS dealing with plant health. So it will be a specialized technical, agency that will have a mandate and clear responsibilities. So I think independence will not be a problem. The only thing is we don't know the timelines when it will be functional. But other than that, I think it will be an independent agency.
Thank you, Dr. Ayaliu. I'm sure we'll all be watching those developments with great interest. As you said earlier, their transformative potential is huge. Your next question then from participants is one that all our panelists may want to have a response to, but I'll turn first to Dr. Phuc, I think. So the question is that food safety policy and regulatory frameworks are important when building a strong national food safety system, but without proper implementation, that simply doesn't work. So how can we consider country contexts such as limited access to internet, low level of literacy, or limited access to expertise in the areas where food is grown or produced? What specific or adapted tools might be needed in those specific circumstances? What are your views, Dr. Phuc?
Okay, thank you very much. So very interesting question. And it's also very difficult to answer it a correct way, but from my side, I think very important that need to really to understand in the real context. So it means that not only one expertise we can explore what the local people they need. When that's why we need to work with different sector, come to identify the rain situation in the rain in a very specific area. So based on that, we know that what they have available sources, what their capacity, how they would like to become to change. So based on that, we can work and make a plan and doing with them and support them in a technical support or advise them and more interaction, bring for them very clear what the benefits they can get after we can change the model. So that means that you not only support for them what they are doing, we need to support them how to find the market for them, for example, and of course how this can impact in their economic or livelihood. So by that, it could be easy for us to convene and working with the local authority. Actually, it's a local government, very strong voice. They are strong to connecting different sectors, including the public and private sector. Also, if we can mobilize the private sector, it can support back to the farmer, for example, or the consumer. So that I'm thinking that, but by that, it has a very important. All need to follow very clear with the regulation of the law of the system. If we are building a very comprehensive surveillance system, but by on a risk-based approach, it could be easy for the management level. They can see that how it's a local authority, they can manage this food safety issue in the way based on its environment sources. So that I'm thinking that in the case that we cannot accept it high technology, but that we need to really to understand and really to know that what the demand, the market demand about the food safety, and based on that we can provide and supply and to make very good supply chain for them in the long term. Yeah, that from my side. Thank you.
Thank you, and I'm struck by your focus on the need to engage with and truly understand the realities as they operate on the ground. Anna Marisa or Amari, if you'd like to come in on the same question, please raise your hand, or we'll continue and consider some more. Anna Marisa.
Thank you. Just a couple of comments. I would say that this is part of the importance of having a food safety culture and how we can involve all the different actors along the food chain. And the second one is we need to bring them into the discussion when we are talking about food safety. So the food safety policy in some way needs to consider these sectors and establish specific lines of actions for them. Thank you.
Thanks, and thanks for being brief. I think I'll stick with you, Anna Marisa, for my next question. How can we distinguish between food safety and food security? And how can the use of international standards help us address both issues? Do you have any thoughts?
Well, I would say that in terms of food safety, it's a matter of providing a safe and nutritious food for the different consumers. And food safety, it's part of the food security. It's part of the food security approach in terms of if we provide food and nutritious food, we are also providing or ensuring food security for all consumers.
Sorry, thanks very much. So let's see if we can rattle through a few more questions. One for Amari now, going back again to African Union initiatives. Can you give some examples of food safety related projects or programs that have been executed by the African Union in various African countries and the successes that you think that they've had? Over to you.
Thanks very much for this interesting question. Actually, the program I'm coordinating, the Partnership for Aflatoxin Control in Africa, is one such program that is implemented by the African Union. As many of you know, aflatoxin is a complex food safety challenge, and which is very widespread in Africa, which also impacts on our staple diets as well as well-developed value chains, as well as export commodities. So in around 2012, there was a decision for a continental approach to address this problem, also partly because of the capacity gaps at country level. So our program is called PACA for short, Partnership for Aflatoxin Control in Africa. So PACA had 6 pilot countries to develop some models for a holistic approach to control aflatoxins. So in those 6 countries, we worked with governments in a really government country-led approach. And, if I have to mention some success stories, in all 6 countries, aflatoxin evidence was generated and aflatoxin control has become part of the national strategies. That's what I was referring to by mainstreaming. And so following that, governments were able to allocate budgets. And not only that, we were able also to attract, investment from outside. For example, one of our pilot countries, Tanzania, is now implementing a $33 million US dollar project on aflatoxin control alone. So now we are actually scaling that to 12 additional countries. So broadening the scope to food safety, and of course with emphasis still on aflatoxin. So we're trying to support 12 additional countries, and it will be, I think, it takes time if I have to list those countries. So anyways, this is one. Recently also together with the University of Laval, AOAC, the USAID, we are also working to build a capacity of lab analysts, because as I said, that is also a big area where capacity building is needed. And also at AU-IBAR, at the African Union Inter-Africa Bureau for Livestock Resources, there have been different efforts in terms of, making African countries' participation in the Codex better. Also, addressing some, especially zoonotic, diseases and so on. So a lot is happening also at AU-AUDA, the African Union Development Agency. There are efforts to harmonize the standards, food safety standards currently underway. So a lot is happening. So by having all of this coordinated, starting with the coherent continental strategy, and of course moving forward with the African Food Safety Agency, I hope we'll achieve better coordination, less overlaps and redundancies, and also more effectively serve the food safety issues of the continent. So these are, by the way, my disclaimer is by no means exhaustive. Thank you.
Thank you. We're rapidly approaching the time at which I need to draw this part of the session to a close. But I'd like to squeeze in just one more question and give each of our participants an answer. So from each of our panelists, I would want just one sentence, just one idea from you in answer to the following challenge. And the challenge is, what one thing will best motivate increased action for food safety amongst stakeholders in your region? I'll turn first to Fook. What's your one idea?
One idea. Okay, one idea from my side, that human capacity development It's an innovative approach to strengthening and scaling up the training and technical. It's a support and education delivery for farmers at a different level, even the big scale or small scale. I think that is very important along the value chain, including the business. So I think that there's a business here, including the public and private sector partnership together. So it's a human capacity building. Thank you.
Thanks, Luke. That was a bit more than one sentence, but let's land on human capacity development. Anna Marisa, over to you next.
Thank you. I would say the importance of working in the implementation of effective coordination mechanism and improving the implementation of food safety policies. Thank you.
Brilliant. So that's top of your wish list. And Amare, over to you last.
So to motivate the stakeholders better, I guess you asked me one point, so perhaps evidence, solid evidence to make a strong case for improving food safety, I think could motivate most stakeholders better.
Thanks. Evidence. What a great place for us to bring this Q&A session to a close. And I'm afraid that's what I must do because we've got no further time. So I'd like to take this opportunity to thank our panelists for their insights and answers today, and for everyone who submitted comments and questions. My apologies if we didn't get to your question, but I'm sure this is a set of discussions that's sure to continue. All that remains for me to do is to pass you back to Dr. Bonnie McLafferty for some closing comments. Bonnie, back to you.
Thank you, Steve. This was incredibly rich, and apologies for the background noise. Apparently construction's happened since we started this conversation. Can I have one, Steve? Can I have one? Yes? Okay. You know, I'm continually amazed, you know, where we are and where we are in the development and the maturity of food safety. And we are relying on government, and we have to. Particularly, you know, given this odd placement between two sectors, agriculture and health, and the agencies that need to be put in place to serve as the bridge between the two. But I would like to talk about the private sector. I would like, maybe in a future exploration, and I think folk has been getting on this, is the private sector is the actor in the food system that actually has to be incentivized to produce safe foods and to create that culture. So I look forward to having yet another one of these. And Steve, if you're brave enough, we'll have you go ahead and chair that one as well, to look at private sector models and really say, you know, the private sector, governments can incentivize private sector because we will never have enough public money to regulate and police our way into safe foods. So somewhere in here, there's public and private partnerships to move forward for food safety. And that is another very interesting webinar. So just to build off of this summit and to build off of this webinar, you know, going into the summit, we had over 100 interested parties that wanted to move forward with action on food safety. And we've been in touch with them, and now we're growing the community. So this partnership is building. But for now, what we're going to try to do is we're going to start with continuing to build the knowledge, continuing with the communication channels. So we will, and I'm seeing in the chat, there are other communication channels that are being set up. We're going to move forward with a series of webinars. So please look forward to that as a next step. Please send concepts that you might have for webinars to share information among us and translate out. Those can be sent to eatsafe@gainhealth.org. Maybe one of my colleagues can put that in the chat. So thanks so much. And thank you for attending. And as we sign off, first, thank you, Steve. Thank you, panelists. I want to thank the people in the background, from Lucienne to Caroline to Haley and Abby. Thanks so much for helping us move this forward. And before I sign off, though, for those who would like to stay on, we have 1 minute. We'd like to share with you a video just to leave you with the sense of the challenge that's ahead of us and to entice you to continue to engage. You will receive, all of you will receive email invites for our next webinar. So thank you, Abby. If you don't mind, could you please start the video? Thanks, everyone.
It's morning at this Nigerian market, a traditional market like many seen around the world, serving both rural and urban consumers. People will come from miles around to do their daily shopping, assuming that what they will buy for their families is safe to eat.
My name is Felicia Danlami. I go to the market to buy the food. How many children do I have? I have 4 of them. The food I make for them, that it make them sick, is my mind. They was going to the toilets every time. That is why I don't cook that food in my house, because I don't want to express that thing again.
To sunan da na maimaita da kaina kamar na farko dai sunana da na bako Alhaji Musa Bebeji. Ina sai da cabbage, green pepper, green beans, carrot, cucumber, beetroot, radish, mint leaf, parsley, celery, spring onions. Wannan kayan da na fara siyarwa na kai shekara 7 kenan ina sai da wannan kayan.
The vendors here are entrepreneurial, resilient, and hustle each day to show off their wares. It's important to their livelihoods that the food they sell is safe.
Mun je kasuwar Talata market. Akwai kayan da na siya sai da na je kasuwa ma na juye shi sai na ga ya ruba da yawa sai na sama yara na ce to su tsince duk wani ya ruban.
Food safety, nutrition, and food security are all bound together. Around the world, markets like this provide access to highly nutritious but perishable foods. But foodborne illness can jeopardize it all. The impact of our public health, nutrition, and agricultural investments, the livelihood of vendors, and most critically, the health of our children.
I buy many things for my children. When I buy the food, this thing that they love to eat.
Masu saya min kaya suna da muhimmanci sosai game da ni saboda duk mutumin da ya san mutuncin kasuwa ya rike kwastoma sosai.
They like to help me with the food. She help me to peel the mangi and pound the pepper for me. She always be there when anytime that I want to cook the food. She help me a lot. She said, "Mommy, I want to taste the food." just so I will know that the food is okay. She said, ah, mommy, your food is good. I will tell her, okay, thank you. When you grow, this is how you'll be cooking for me. She said, okay, mommy, I'll cook the food for you.
Traditional markets play critical roles in feeding and nourishing the world. They can and should always be a hub of safe, nutritious food. USAID is investing in food safety research, working with governments, supply chains, vendors, and consumers to help make every bite as safe and nutritious as it can be.
Goodbye, everyone. Till next time.